but this is incredibly safe. And so while we have to do some experimentation, we do so with some confidence and safety. Also, this requires, this partnership that cannabis necessitates empowers patients to take care of themselves. This is not just a top-down doctor telling the patient what to do, but providing the patient a tool that they can use to heal themselves and to improve their own lives. That is better than relying on someone else to do the work for them. This is putting the tool in their hand and allowing them to use it. Self-care and self-efficacy are cornerstones of good results with cannabis. And as cannabis broadens to larger populations, we have to keep in mind that people are going to get best results with cannabis when they believe that they can take care of themselves, when they have confidence in their ability to do so. Also, the horticulture is incredibly therapeutic. For someone who's sick to be able to plant a seed or plant a cutting, watch it grow, harvest their own medicine, produce it into an oil or some other form, and then take it, figure out their own dose. This is a very therapeutic process that can relieve suffering even before they ingest the medicine, because just watching something grow and being a part of this movement is therapeutic. That's the partnership that cannabis brings to medicine. The second principle is that integrative medicine focuses on appropriate use of both conventional and alternative methods to facilitate the body's innate healing response. This isn't about just suppressing symptoms. This is about identifying what is the body already doing to heal and how can we help it do so? How can we remove obstructions in the healing process? How can we augment the healing process? Well, of course, cannabis is a prime example because we all have an endocannabinoid system. From before we're born to the day we die, our inner pharmacy is producing cannabinoids for the purpose of keeping us healthy and responding to illness and injury. This is an ongoing process happening every minute of our lives. And so we have this widespread endocannabinoid system that's all through the brain, it's all through the body, in every organ, in every tissue, in all of our bones, all of our cells. And we can target this system with this incredible plant. This is a way to augment the healing system, to work with the body's innate healing ability. And I'll summarize with this conclusion from two leading researchers at the National Institutes of Health, a paper from 2013. They said that modulating endocannabinoid system activity may have therapeutic potential in almost all diseases affecting humans, including obesity, metabolic syndrome, diabetes and diabetic complications, pain, neurodegenerative, inflammatory, cardiovascular, liver, gastrointestinal, and skin diseases, psychiatric disorders, cachexia, cancer, and chemotherapy-induced nausea and vomiting, amongst many others. It sounds too good to be true, but this is the truth. We can affect almost every illness that humans experience by working through the endocannabinoid system, and we can do so with the plant cannabis. The third principle of integrative medicine is consideration of all factors that influence health, wellness, and disease, including mind, spirit, and community. Medicine and science in general has become so reductionistic. They like to think about not even the person, just the diagnosis. What can I do for this diagnosis? What drug can I give? Without recognizing the context that this is a whole person that may have one preference or another, that they live with a family that's impacted by their condition, that they are part of a community that has a certain social format, a certain economic status that makes certain treatments available or not available. We have to take mind, spirit, and community into consideration when we practice good medicine. And I would like to take this opportunity to mention that the spiritual properties of cannabis, in my opinion, are still some of the most powerful aspects of this medicine. And this is overlooked quite a bit because now I typically see patients, my new patients come to me and they say, I finally agreed to come have a consult. I'm ready to give cannabis a try, but I don't want to get high. I don't want to feel intoxicated or impaired at all. And I say, fine, you don't have to. Because almost always when you're treating a symptom with cannabis, whether it's pain or spasticity or nausea, there will be a dose that controls the symptoms, and there will be a dose that causes some type of intoxication or euphoria. And there's a window between those doses. So you don't need that euphoria in order to benefit medically from cannabis. But I don't want to forget that this is one of the primary healing aspects, and that this is very good for people. And so often in our culture, people need things like positive mood, relaxation, laughter, having an easier time socializing and making connections with the people around them. Having time distortion, which can be very helpful because humans, we have this very unusual ability to think abstractly. And this allows us to do wonderful things like have written language and communication. It also enables us to think ahead to the future and spend so much of our lives worrying about what might happen. It allows us to worry about what happened in the past and have regrets from the past and miss out on the presence of this moment, which is just beautiful right now. Cannabis can do this for people and bring them back into the present moment, something that's so helpful at the end of life, which we'll talk about at the end of this lecture. Cannabis can also intensify ordinary experiences like listening to music, watching films, having sex, eating, and so forth. These are real benefits of cannabis that should not be overlooked in people that are suffering. Many of my patients report that when they experience the consciousness-altering effects of cannabis, they begin to see and experience their symptoms in a new way, where previously the symptoms were all bundled together like one big ball of suffering. Cannabis helps people separate this out. And so instead of just feeling this agony, people say, well, there's a sensation. And that sensation, scientifically we call it nociception. This is a signal from the body to the brain. And then that signal is interpreted as pain. People realize, oh, that sensation, I could interpret it as pain, or maybe as something more neutral. The judgment on the pain as being bad leads to more suffering. Then there's the anxiety about staying in suffering. What will I do? How can I get out of this suffering? And then all of those behaviors that come from this experience, like moaning and groaning when people are around their loved ones, or changing their face with a frown, or working differently, all of these pain behaviors which affect the family and the community, not just the individual, people can start to untangle that and reduce the symptoms to something that is still present, but much less bothersome and much less likely to produce suffering. Cannabis is an incredible gift in this way. These are some of the mental and spiritual properties of this medicine. My patients report increased self-awareness, a sense of connection to God, nature, etc. Viewing oneself from a different vantage point. Fostering acceptance. Yes, I know I have this disease. I know that this may not ever change, but I'm willing to accept it. That immediately reduces suffering. Helps people find creative solutions to their problems and promotes mental, emotional, and physical flexibility with increased capacity to change. Also, community. There are so many examples. I have just a couple here, but as you can see, cannabis has this incredible quality of bringing people together, and what an incredible crowd we have together today. So thank you so much. I love what I see when I come to Chile with Fundación Raya. This is community. This is how we heal as a community. In the United States, we have the Society of Cannabis Clinicians, which are a group of doctors working together in community. In my state, Maine, we have a group called Maine Children for Cannabis Therapy, similar to Mama Cultiva. The parents, especially the mothers of these sick children, have been an incredible, powerful instrument of change, social change and political change. All right, back to the principles of integrative medicine. A philosophy that neither rejects conventional medicine nor accepts alternative therapies uncritically. Recognition that good medicine should be based in good science, be inquiry-driven, and be open to new paradigms. Well, when it comes to good science, thankfully, we have quite a bit of it around medical cannabis now. People that are unaware will say, well, there's no science to support this. In fact, there's more science to support the use of cannabis than there are many approved pharmaceuticals and medical treatments that are commonly used in conventional medicine today. This is a 2017 report from our federal government. You can download it for free. It does a nice job of distinguishing the medical use of cannabis versus the adult recreational use and exploring those findings. And some of those findings are that there is conclusive or substantial evidence that cannabis is effective for chronic pain, for chemotherapy-induced nausea and vomiting, for spasticity associated with multiple sclerosis, that there's moderate evidence that cannabis helps with sleep disturbance associated with a variety of conditions, and that there's limited evidence that cannabis can be helpful for so many other things, meaning the early evidence is there, but we need more research to substantiate this, including, very interestingly at the bottom, that there's evidence of an association between cannabinoids and better outcomes after traumatic brain injury and intracranial hemorrhage. We'll talk a little bit more about that. Another principle of integrative medicine, the use of natural, effective, less invasive interventions whenever possible. It seems like this makes sense. I hope as you hear these principles of integrative medicine, many of you are thinking, well, these are just principles of good medicine. This doesn't have to be special, but unfortunately, this isn't always the case in conventional medicine. But cannabis, as I mentioned earlier, is just incredibly safe. A 1999 report from my federal government found that the adverse effects of cannabis are within the range tolerated for other medications. If one of my patients accidentally took 1,000 times the dose of cannabis that I recommended for them, there would be no death, no organ damage, no permanent cognitive deficits in adults, especially including in recreational users, and even in medical users, we see improvements in their neurocognition. It's a very low risk for abuse and diversion of cannabis, especially with medical preparations. So this is a very safe, less invasive treatment strategy. So like Dr. Pineda was suggesting this morning, why does cannabis have to be a final approach? With a last-ditch effort in patients that are very sick, why not make it a first or second-line treatment if the benefits and risks when compared to the other alternatives are more favorable? These are the primary adverse effects of cannabis, and on the top left, dizziness, dry mouth, fatigue, sleepiness, euphoria. This is what we see commonly. The rest of the side effects on this page are due to taking too much THC, not an appropriate dose, but an excessive dose. Things like depression, disorientation, anxiety, confusion, nausea, vomiting, diarrhea, paranoia, and hallucinations. If we understand how to dose cannabis appropriately, we can almost always avoid those side effects. The seventh principle is the use of broader concepts of promotion of health and prevention of illness, as well as the treatment of disease. Doesn't this also make sense? Why must we wait till someone is very sick before intervening? Couldn't we prevent them from getting sick? Wouldn't that be less expensive, more effective, and overall better for the quality of life as a whole? So I think that cannabis has many, many opportunities for preventative medicine. For example, low-dose THC in mice has been shown to reduce atherosclerosis. This is the buildup of hardening of the arteries that leads to cardiovascular disease. There is some human data that suggests that people who are cannabis users may have better outcomes when they have events like heart attacks. For example, this large hospital review of over 1 million patients found that cannabis users had less death after a heart attack than non-cannabis users. They also had less shock, less need for intervention called a percutaneous intervention and so forth, but they had higher levels of needing respiratory support, likely because they were smokers. But could the cannabis be protecting the heart? There's certainly some animal study evidence that suggests this is the case. There's also evidence, as mentioned earlier, that cannabis users have decreased death after traumatic brain injury quite a bit. And this